Hello, and thank you everybody for joining us today on this very exciting episode of Lyme Recovery. I am Heather Gray with Discovering Health, aka Lyme Boss. I help destroy brain fog, digestive issues, and fatigue in fast-paced professionals who have gone everywhere and their labs look normal, but they feel anything but normal, right? How many of you can relate to those? Today, we've got Leslie Perrin, and she is a nurse. She is a national board certified health coach. She's also a gluten-free practitioner. This woman is definitely a practitioner after my own heart, as I am celiac, right? I'm also a functional diagnostic nutrition practitioner. My mother was a nurse. My grandmother was a nurse. I actually thought about going back to nursing school after I got my functional certification, but I actually had a couple doctors look at me and tell me, they're like, you wouldn't be able to handle going the other way around. Like, it's one way to go from nursing school to functional stuff, but to go from functional stuff to nursing school, like they said, I wouldn't be able to swallow the crap that they're going to try to brainwash me with. And so I never went that route, but I'm super jealous that you're a nurse and I'm not. But how cool are you? I actually first learned about you when I read an article that you wrote on, was it histamine intolerance?
Yes.
It was histamine intolerance. That was a freaking like all kinds of light bulb moments. Like, that was just so eloquently written. And I just think you're so damn cool. And so when you're like, yeah, I want to be on your podcast, I was like, awesome. So Leslie, tell us a little bit about yourself. Why you got into these areas of practice that you got into, right? Because I really like to kind of get to that backstory, why we're doing what we're doing, because it helps to bring a human connection into just the clinical. And then also kind of let's dive deeper into the, the chronic joint pain, and is it arthritis or is it Lyme, and how do you tell all the difference? And so take it away, Miss Leslie.
All right, terrific. Well, thanks so much for having me, Heather. I really appreciate that. And as a sister FDN practitioner, I really appreciate being a part of what you're doing and sharing with your audience, because like you said, going from being a functional practitioner back to being a nurse is definitely a different path. And I took the long path of being a nurse for 40 years.
Wow.
And I actually worked with patients who had chronic pain. I worked with patients at their end stage of life with end stage diseases, particularly focusing on cancer and transplant, blood and marrow transplant, and also worked with solid organ transplant patients, and actually worked with palliative care team. So in my experience of that, what I learned was people had to become dependent on traditional forms of therapy, many times opioids or non-steroidal drugs, that ultimately impacted them negatively in many ways, whether it's how they functioned with their brain, or just even organ or other adverse effects that can happen from taking those types of medication.
I had brought up that my mom was a nurse, and she had 10 back surgeries in 8 years and got addicted to opioids. And then she got to the point where she was stealing IV Dilaudid from her patients at work, and then ended up in prison, basically. So I've had to detox my mom off said opioids. And so I've seen firsthand at the level of damage those kind of drugs can do on a person.
Well, she's fortunate to have you, because, I certainly experienced some very sad experiences with people who had become addicted and dependent. And I was actually on the hospital's pain committee. I was one of the system people for the University Hospital, because the opioid epidemic became such a problem. And so later in my career, in the last 5-6 years of my career, I started experiencing my own pain from arthritis, and I also had autoimmune disease with Hashimoto's thyroiditis, and I was finding it very hard. I would get locked up, and as I tried to get out of a chair, sometimes I could hardly get out of my car in the parking garage and make my feet move, and I had quite the distance to walk. And as a nurse, of course, I had to walk a lot. And then it interfered with my ability to really relate to my grandchildren, and my grandchildren, now I have 9 grandchildren. But at the time, I was just starting to have grandchildren. I thought, I can't even play hockey with my grandson. And this really bothered me. It was really impacting my quality of life. And so as I thought about retiring from my nursing career, I really thought, I want to help people even get there in the first place. And so that's why I started to study functional medicine, and thought, I really want to help people stay out of the hospital, or even get better without even entering the hospital, and help them figure out what's going on. So that's why I love FDN.
Well, so back up just a little on a personal note, hockey with your grandson, who says that? So where are you located? What part of the world are you in?
I'm in Minnesota.
Oh yeah, you betcha. Okay, I kind of figured you had to be somewhere in that direction. I was like, hockey with your grandkids, because that's just not something. I'm in Colorado, right? So we hike with our grandkids, or go river rafting with our grandkids, but not so much play hockey. So I was just curious as to where you were at.
Well, and actually, I couldn't even get on the ice. Now, I was an ice skater. I used to skate 6 hours a day as a child. And so it really, that's part of what affected my feet, but a part of, long term, just even from fitting in and staying in those skates all the time. But I also developed autoimmune disease. And so I had many factors playing into my bone pain. And I was actually playing street hockey with him because I couldn't skate. But I couldn't even do that. And he's in California. He's actually playing in California on the ice. And so we just got him a hockey stick for his birthday last spring. So he was super excited.
That's awesome. And I shouldn't say that, because I think didn't the Avs win the freaking World Cup this last year?
I don't know.
Oh, so yeah.
I don't even follow
They've
all
got
of
a
it.
halfway decent hockey team, but I'm pretty sure the Avs, won the cup this last year. But anywho, I digress. So how did you dive in a little deeper? How did you develop an autoimmune disease?
So, it's interesting. I have a family history of autoimmune disease, and my mom, in fact, has 3 autoimmune diseases. And as I stopped my childbearing years, I had 4 children. I started to feel very sluggish, and this was towards the end of my 30s. I felt I was gaining weight. I just didn't have the energy level that I used to. And so I started the traditional route of treating that disease. And I was very frustrated because even though my lab tests that are typically performed by traditional endocrinologists, and I went to an endocrinologist, showed that I was okay and in the normal range. As we know, as functional practitioners, what's normal for traditional labs, and actually the cadre of labs that are done by traditional doctors to look at the thyroid are very different than what we might look at as functional practitioners. And so was very symptomatic. This went on for many years. Never felt like, and they kept saying, yeah, you're fine, and never changed my meds. Well, I learned on my own, as I started to study functional practices, and this was actually before I did some of my coursework, I did a gluten sensitivity genetic test and found out that I was gluten sensitive. And of course, gluten sensitivity is associated with the development of autoimmune disease, including, like you said, you have celiac. Mm-hmm. And in my case, I developed Hashimoto's thyroiditis. Well, that set me on a journey of figuring out and working with a functional practitioner. And I'm not going to bash, because I am obviously traditional in the form of, I believe as a nurse that is always room for traditional practices, but I also think there's a big picture to look at the body holistically. And I learned how to really recorrect and rebalance my body with functional approaches, and doing some functional lab testing as well as some traditional lab testing, but digging deeper into my thyroid to rebalance my body. And I've been gluten-free, which is a big important thing when you have autoimmune disease, for over 10 years now.
It's one of the top, and I want to hear you say it too, because they need to hear it from somebody other than me. I've been banging that pot for a long time too. Like, one of the top 5 causes of autoimmune diseases, especially Hashimoto's, are grains.
Right.
Grains, right? So you got, well, what about rice? No, you can't have rice either. I mean, if you're a certified gluten-free practitioner, a lot of people don't know that even corn and rice all have a form of gluten themselves, right? And
Yeah, it's true. And actually, these things can cause mental disorders too. In the hospital, we had a teenager who it took many hospitalizations that she had intractable schizophrenia, what used to be called bread madness, but in this case, she had corn.
hey,
As a sensitive, and they didn't find it. Her parents found it out independently of the hospital. And once they removed corn, she did not need to be on her medications anymore. So it's very interesting, and you can test obviously for gluten sensitivity, and there's many tests available to test for wheat sensitivity or corn sensitivity or rice sensitivity, and so you can really hone in and find out what your body responds to. And I think the whole point about this is it's very individual, but as you and I know, Heather, when we deal with people with autoimmune disease, taking out gluten is really a permanent thing. It's not a temporary thing like it may be if you show other signs of other types of food sensitivities where you might be able to reintroduce foods.
absolutely. That corn thing was tough. I'm got a quarter Mexican in me, and I grew up with, Mexican food. And I swear I had a harder time giving up corn than I did wheat. Like, I still miss my corn chips and everything corn. I miss corn, but I don't miss what it was doing to me. And cognitively, yeah, I was going downhill fast. And it's amazing how much I have been able to reverse and get my brain back, get my body back, lower the pain. Like, it's insane.
Yeah, and you and I know the gut and brain are totally connected, and that's why many times people are feeling brain fog or fatigue from eating certain foods, and it's so connected,
Absolutely.
and yeah, it's important to check it out.
So how did you get into the Lyme world? And let's talk a little bit about the Lyme and the arthritis and all that fun stuff.
Well, I think what's very challenging, and in our FDN practice, we know that we don't diagnose people, right, and we're not treating them. We're really helping them figure out and do the detective work to figure out what's going on in their body. And there's the chicken and there's the egg, right? There are many things that can cause an imbalance and result in what a traditional physician would label in a diagnosis. But when we have symptoms like chronic pain, and I was certainly very interested in pain and gluten sensitivity, it can be triggered by different things, right? The symptom is just a manifestation of whatever imbalances are going on in an individual, and every individual may have different triggers. And so just looking at a diagnosis and treating with medications isn't really solving the root issues of what's happening in an individual. And that's really why it's important to test each individual, because they may have different things or different imbalances that need to be rebalanced and corrected.
Absolutely. Absolutely. So how do you tell the difference if it's Lyme or if it's arthritis?
And that is very challenging. In fact, most clinicians will jump to a rheumatoid arthritis diagnosis for a patient, particularly if they think, okay, well, maybe they have Lyme, and do the typical Western blot and Lisa testing. Those tests can have a high rate of false negatives or positives, right? And so I say, okay, you don't have Lyme disease, so you have rheumatoid arthritis. And, rheumatoid arthritis, they may look at certain antibodies, rheumatoid factors, or x-rays, et cetera. But often they're quick to label it as rheumatoid arthritis and start that patient on a rheumatoid arthritis protocol, even though a person could have Lyme disease, because the testing doesn't show necessarily all of the types of organisms. And so like if you do a functional panel, like a vibrant test for tick-borne disease, that may test for a broader array of tick-borne disease or tick-borne organisms. And so that can help really hone in on whether or not it's a Lyme related condition. But in Lyme disease, I mean, it can be very confusing. Typically, right after you get the typical bullet type of rash. Within 4 months, if somebody's going to have an arthritic complaint, it may be usually a knee joint or something that is related to a one-sided type of joint pain. And it's an intermittent type of pain and not necessarily continuous pain. But if they have a rheumatoid or arthritis or a form of autoimmune arthritis, that can be more generalized and is usually a symmetrical form of pain. And it's a pain that can do what is called flare under certain conditions for that individual. And so those are sort of signs and symptoms. And of course, in Lyme disease, if a patient is treated with antibiotics, say, and they have Lyme arthritis and they're treated, they could later on, they could be refractory to antibiotics and develop what's called a refractory arthritis, Lyme arthritis. And then long-term, an individual could develop an autoimmune arthritis that had Lyme disease, but not all Lyme disease leads to an autoimmune arthritis. And if you just have autoimmune arthritis and Lyme isn't a factor, that can take 10, 20, 30 years to develop, depending on diet, hereditary factors, and other things, like in my case, gluten sensitivity.
Yeah, absolutely. And even the Lyme can have its own little set of flare-ups as well. I mean, especially if you've had chronic Lyme like myself for over 27 years, and there's a pretty strong belief that you don't really get rid of it after you've had it for so long, that my immune system just kind of keeps it in check. But I know that I can flare up with the Lyme with my joint pain if my stress level gets too high, if I've, drank too much alcohol, stayed up too late, done all the things. I really have to be like a saint, because I also have the genetics that doesn't allow me to detox things properly, and I'm more susceptible to mold. And so I really have to walk that very fine line. And I do it most of the time happily, because how many people who've had Lyme disease, Hashimoto's, endometriosis, celiac disease, 3 stints to the psych ward for trying to, commit suicide, diagnosed bipolar. There's not too many people who can sit here and function the way that I do. And so it's a funny line to walk, but I gladly do it now, because I've seen the alternative. And that, like you, with not being able to play with your grandkids and the pain, and like people who don't know chronic pain, they don't know chronic pain. Like my ex-husband couldn't relate to me at all, ever, so it's just fascinating. But the people, that's why I wanted to hear your stories, because a lot of times those of us that are in the alternative practices, right, we've got here because of our own story.
Right. And I think you bring up such a valid point. Even though, I was trying to sort of say what the typical things are. Nothing's typical. Everybody is an individual, and the factors that you mentioned that contributed, and other individual have other factors. And we don't know all those factors, right? Unless we start diving into them. And that's the beauty of being a functional diagnostic nutrition practitioner, is really trying to do that detective work and helping out uncover for that individual what is contributing to what their symptomatology and why they're having pain.
I don't know if you're like me, but like when I get lab results, it's like Christmas morning, because I mean, really, I get so freaking giddy when I'm looking at a person's, digging through. Aha, this is why they feel like shit. Aha, this is why they can't sleep at night. Well, no wonder she's a moody bitch. I love that, because when I got those answers, I mean, I just bawled and I bawled and I bawled, because I felt seen and I felt validated. I was never allowed to be sick before. And, obviously I don't want to stay there, but there's something there's not something, inherently wrong with me. Like I'm not well. Right. And just what a gift that is to give to people. Then I go over it and they're like, why are you smiling like that, crazy lady? And I'm like, no, because I'm about ready to give you your life back. Like, here's some awesome tools. So I love lab results day. It's like my favorite day ever.
Yeah, and I think the key, as we know, is while the lab results are so cool, we are correlating them
Yes,
with
absolutely.
why the person is feeling them the way they are. We're not just saying, oh, your lab test shows X, so you need to do Y. We're looking at the cadre of different inputs, right? The different symptoms, the different information that the individual provides to us, and putting those pieces of the puzzle together to really try to help understand what's going on for that individual and to personalize a protocol that's for them and not just sort of saying, oh, you have Lyme, do this.
Right.
Right.
Well, a lot of functional practitioners kind of fall into that same damn conundrum that traditional doctors do. They'll just, instead of using a prescription, they use as a supplement, but they're still doing the same thing. They're still treating the paper, right? They're not tying everything all together. They're not talking about lifestyle. They're not talking about stress and mental health. And so if you go to a practitioner and all they're wanting to do is put you on a shit ton of supplements and not talking to you about how are you sleeping, what's your stress level like, what's your, go down the ranks. And if they're not doing that, freaking run, because you're just going to be stuck on these supplements the rest of your life. You're not actually getting to the root causes of anything.
And that is so important. I think we all tend to say, I mean, just naturally to say, well, this worked for one person or several people, so automatically this. And I think it is important, like you say, that we really try to check in with an individual between our sessions to really see how are they responding to whatever initially we recommended to them, and that, or as we approach each session, to figure out what's working or what's not working. And they have to self-titrate whatever protocol to make sure that their body's responding well. You can't just necessarily say, here's all the supplements and expect them to take them all at once, because many people can't do that without experience significant symptoms.
I had an acupuncturist do that to me one time. I walked out of his office with over $300 of standard process products, no explanation how to take them. So of course I'm taking them all at once, and then I was so sick. So I was so pissed off at him too, because it's like, you spend that kind of money just to get sick. Like, what are you thinking?
Yeah, I mean, and so self-checking yourself is really important. I think before every session, really just sort of making sure you really are refreshing yourself with this particular individual, how you've communicated with them in the past, and maybe any things that messaging that they've provided you in between sessions, and really trying to help explore that with them, and figuring out, do you need to revise the plan, right? or continue on that path, maybe in a slightly different way.
Absolutely. So tell me, this is shameless plug time. Do you have anything coming up, a book coming out, a launch that you're doing? What do you want to
Yeah.
plug?
Well, I think really what I would like to say is that I do offer a free discovery call, and I provided you with a link to that, and actually a free ebook that I call 3 Steps to Feel Better, Move Better, and Live Better. And to have people maybe check that out, and it tells you a little bit about how I work with my clients, and the 3 top things that I do when I work with them, so you get a better sense of what it is and how I do it. And then there's an opportunity for a free 45-minute consultation to really get to know one another, and to really see if there might be an opportunity for me to help that particular individual, and see if it's a good fit.
That's awesome. Thank you so much for being here today. I really enjoyed having you on.
Well, I love talking with you, sister.
Yeah, right.
So yeah, the best to
laying out your
you.
credentials, and I was like, oh, a woman after my own heart.
Yeah, and don't go back to nursing school now. I mean, I love being a nurse, and but I think this is my nursing 2.0, so to speak.
Right. Absolutely. No, I'm in the middle of taking an advanced mold course, an advanced blood work course, an advanced thyroid course, an advanced something else. I don't actually need to go backwards. There's so much that I can continue to do, that I do continue to do, because I can't get enough.
Yeah.
I love.
And I love that too, the constant learning and those opportunities that are provided to learn more about functional things like you are studying now. And I do love that learning, and I'm doing the same. So yeah, hang in there and
Yeah.
enjoy.
Awesome. You too. Thanks again, you guys, and have a healthy day.